Hello everyone, welcome back to our channel. In today's video we're going to chat about melasma, what causes it and treatment options. Before we get started, if you're new to this channel, welcome, and don't forget to subscribe and hit the notification bell. If you're a returning visitor, welcome back and thank you for all your support. So let's just dive right in. What is melasma? Melasma is an incredibly common skin condition. It's basically development of excess hyperpigmentation, often on the face, can also affect the neck, and it's a very specific pattern. It tends to be a kind of large patches of hyperpigmentation, and it tends to mainly affect the forehead, cheeks, around the nose, but sometimes the temple. It can also, like I said, affect other areas like the chin and the neck, and the pigmentation, the pattern is generally symmetrical, so you'll find it on both sides of the face and it'll look similar. This skin condition occurs when there's kind of excess activity of the melanin producing cells, but there are some important triggers for it, and there are some, whilst we don't fully understand the mechanism by which this occurs, we do know that it is firstly much more common in women than men. But about 10% of melasma cases are men, and about 90% are women. The second is that melasma tends to affect people with more pigmented skin tones, so it can happen to anyone with any skin color, but it is more likely to happen and to be more severe in people with kind of olive all the way down to deeper skin tones. The other is in terms of triggers. We know that one of the biggest kind of triggers is sun exposure. It tends to also feed the melasma and tends to make it worse. It tends to reactivate it. So that is a big one that is common for pretty much all melasma cases, is sun exposure. And sometimes even if you think you're protecting your skin, with melasma, it may not be enough. Even sunscreen may not be enough, and we'll talk about that in a second. So sun exposure is a big risk factor. The other is hormones, and we do know that hormonal conditions, at times when there are hormonal changes, are associated with melasma. So for example, up to 50% of pregnant women will experience melasma. So there's a big kind of driver from that kind of increase in estrogen. We also know that melasma can occur around the menopausal period as well, so that's another time. It can also be triggered by certain forms of birth control or hormonal therapies, so being aware of that is useful. A third component is it's very likely that there is a genetic element of melasma, and we know that if someone in your family, if people in your family have melasma, you are more likely to get it than someone who has no family history of melasma. And so from that you can see actually with a few of those things like genetics, there's not much you can do about that. Hormonal changes, again, there's not always a lot you can do about it other than being aware and noting it. And then things, really the only thing that remains is kind of sun damage as a risk factor. And also what treatments we can use. And so that's sort of the trigger. And when melasma occurs, it can be sudden or it can be gradual. But what tends to happen is once it appears, it kind of stays in the same pattern. It doesn't often tend to spread. It tends to be the same pattern, but it can get, people will notice that, will say that, during the summer it gets darker, it gets worse, and during the winter it fades away. The good news with melasma is there are treatments, and it is a lot of the treatments that work for things like post-inflammatory hyperpigmentation, general hyperpigmentation work the same. But before you consider treatments, the first things to do if you do have melasma, obviously get it checked out, make sure it is melasma and it's not something else that's causing hyperpigmentation or any changes in your skin. The other is to try and figure out whether there's an obvious trigger. So whether it was sun exposure, whether this is a period of hormonal changes, so if it's pregnancy, if it's menopause, those are things to kind of take note, even if there's not much you can do about them. The other is if you've started a new medication have a chat with your doctor to just see in case that is potentially a side effect or a trigger for it. Again, if you notice melasma in the context of other changes in weight, changes in the way you feel, get your doctor to kind of check you out and check there isn't a metabolic condition that's maybe kind of triggering this as well. Things like thyroid dysfunction or anything like that, and that your hormones are all okay. So that the second bit is, as we said, melasma, a big trigger is the sun, and even if the trigger isn't the sun and it's something else, the sun drives melasma, it feeds off it, and so you have to protect your skin. If you're not wearing sunscreen all day, every day, regardless of the weather, SPF 30 at least and broad spectrum, then you should start straight away. If you are already using sunscreen, make sure you're reapplying it during the day. If you're already using sunscreen and reapplying, then you might need to make sure that when you're outside, you're wearing a hat, you're in the shade at the peak of the sun. All these kind of other kind of common sense advice about sun protection really apply even more. Treatments wise, well, we're going to go from kind of basic all the way upwards. So with melasma, really, in terms of over-the-counter stuff, other than sunscreen, you can try things like kojic acid, tranexamic acid, retinol is going to be a big one. You're going to want to also be exfoliating, so whether it's things like, if you have sensitive skin, azelaic acid, if you have otherwise things like glycolic or malic, those exfoliating acids, it's a combination. Arbutin, especially in people with kind of lighter skin tones, can help quite a bit. And those are your mainstay of things. So you want some sort of exfoliant that your skin can handle. You're going to want some sort of pigment suppressor like arbutin, for example, if kojic acid. You're going to want something like tranexamic acid that can also help. And you're going to definitely, if you can tolerate, want a retinol as well. That may help improve or keep them, keep the melasma under control, but more often than not, people may need something extra. And that's where prescription treatments may be appropriate. And the big mainstay of these that we tend to use are things like tretinoin, which is, a prescription retinoid, and that helps with skin cell turnover, and that can help fade hyperpigmentation that way. And then more often than not, hydroquinone, which is again a prescription medicine, but it suppresses the melanocyte activity and excess pigment production. So if it's used correctly, it can fade the patches of hyperpigmentation without affecting or overly lightening the rest of the skin tone. But it has to be used under medical supervision. It has to be used carefully because if hydroquinone is used at inappropriate strengths or inappropriate times, it can actually worsen the melasma, it can worsen hyperpigmentation, it can cause things like ochronosis, and I'll leave a link to an article about that below, which is where the pigmentation gets paradoxically darker. And it can also just affect the skin itself and make it kind of, it can also just overlighten the skin otherwise. And so, but if used correctly, it works really beautifully with melasma. Tretinoin also is really important. I tend to pair the two unless there's a reason not to, and because they work in different ways. And then you're also looking at things like high strength azelaic acid, which at 20% concentration has been shown to have a similar effect to hydroquinone, but the difference is with azelaic acid you can use it in the long term, and it has other skin benefits as well. And so that's something that may be an alternative to hydroquinone, or it may be something that where you use hydroquinone initially and then sometimes I'll switch patients over into azelaic acid. We may use a combination together. It really just depends on the melasma, this patient's skin condition, the type of skin, their skin tone, and also their preferences, and you work around that. Those are kind of the main. Sometimes tranexamic acid can also be used as part of kind of compounded medications, and we sometimes use that and niacinamide, and these can also help within that context. Occasionally, we add a little bit of hydrocortisone to some melasma treatments that can help kind of suppress some of the inflammation and also allow stronger products to be used initially, things like the tretinoin and hydroquinone, which can cause irritation. Again, every patient's different, but I'm just giving you kind of the mainstay of treatments that, based on the evidence we know, do work well, and based on kind of what I see in our clinical practice as well. Beyond and with skincare for melasma, you'll have to imagine there's like the treatment phase and there's the maintenance phase. And so if, for example, you're on prescription treatment with hydroquinone, we don't tend to use it for no more than a maximum of 6 months consecutively before you have to come off it for a break. Hopefully you won't need to use it again, but at least there's a break of a few months before you can use the next course of hydroquinone to ensure that it's safe. But it's not something that you would use in the long term. It's really just there to do a job, because with hydroquinone, you'll either respond to it or you don't. If you don't respond to hydroquinone initially at all for that first period of a few months, then doing more hydroquinone isn't going to help things. But how much you respond, that varies from person to person. We don't know until you start. But again, the mainstay tends to be, we would then complete your treatment with tretinoin, azelaic acid, other things that you can be on indefinitely. Tretinoin, azelaic acid you can be on forever if you wanted to be, as long as your skin tolerates them, you're not pregnant, you're not breastfeeding, which, by the way, things like hydroquinone, tretinoin, high-strength azelaic acid cannot be used if you're pregnant or you're breastfeeding. So that's something else to bear in mind with melasma treatment. And then after that, let's say you've responded well, your skin is completely clear, you're super happy. This is great, but it doesn't mean that you can just stop everything completely. So at the most people tend to just stay on something like tretinoin for maintenance. Obviously, really strict sun control, sun protection. Otherwise, if you don't want to, you can't stay on kind of prescription skincare, skin treatments, then you'll need to step down to something over the counter. And I would say for most people that's going to be a retinol and potentially something like arbutin, tranexamic acid, or vitamin C, all the usuals to just really make sure that the skin is protected against antioxidant damage. There's still a little bit of skin cell turnover, and just to kind of maintain that. And again, sun protection is a must. You must really be strict with that, because unfortunately what can happen to people with melasma is it can rebound. And let's be honest, it can rebound even if you are really well behaved. That's something to just bear in mind. You might be unlucky and it can do that. But you are more likely to have this cycle of kind of rebound and then have to go on treatment and improves, and then you rebound again if you don't do a few things. So one is really strict sun protection always, even on days when it's grey, it doesn't seem like there's much sun, even if you're indoors but working next to a window. The second one is withdrawing of treatment too quickly. So if you're doing really well on your treatment, then it's really important to withdraw the treatment gradually and have something for maintenance. So especially if it's things like hydroquinone, we don't tend to just stop them suddenly. We kind of taper them and move on to another treatment to kind of maintain and keep doing that. And again, if you are on tretinoin but suddenly you want to go to over the counter, it's kind of bringing those in so that there's a continuity. So those are the two big things. The other is just to be patient. It takes quite some time to treat melasma, to also understand that everyone is a little bit different in terms of what their skin responds, to give treatments time to work, and for most people something will work. Beyond skincare and topical treatments, there are, of course, professional treatments, and I think probably the two big ones are going to be things like chemical peels and laser. Don't waste your time with things like microneedling. Sometimes people say that's for hyperpigmentation. It really isn't. Chemical peels and lasers are going to be your two big treatments. And again, these are going to need a course of treatments. You're going to need to use some protection throughout that whole time and after it. Again, you'll need to give that time to work. So whether it's peels, whether it's lasers, nothing's going to work after one session or overnight. And just have a very good kind of upfront discussion with your practitioner about how long they think. And even if they give you an idea and a range, be prepared it may be a little bit more, but keep that in mind. And of course, for some people, it may be a combination of these. It may be a combination of skincare, prescription skincare and professional treatments. So again, just keep that in mind. It's important to just have this idea that you might be on the better side of things, where you can respond a bit sooner, or it may take a little bit, but don't jump around between treatments. Give everything a chance. There is no skin treatment that's going to immediately work. Most things need a minimum of 6 to 8 weeks to even just start to see something, even no matter how minor. But often it's longer than that. I hope that's useful. I'm going to leave some articles on melasma and some of the treatments that I mentioned so that you can have a bit of more info. If you like this video, don't forget to give it a thumbs up. Don't forget to subscribe to this channel and hit the notification bell if you haven't already done so. Until next time, stay beautiful.